Hi, my name is Caitlin West, and I'm here today to talk about the health and mental issues that arise from a teen pregnancy, from both during the pregnancy and afterwards when they are parents. These issues don't just affect the parents, but the child as well may experience some of these health issues. Philip Baker writes from the book Teenage Pregnancy and Reproductive Health that teen motherhood was found to be associated with increased risk of poor maternal mental health around the time of the pregnancy and into later life. Although the pregnancy may not always be the cause of the depression, it could increase depression that is already there. So if the mother was not suffering from depression before the pregnancy, what can cause the depression? One of the main reasons for poor maternal health is stated in an article written by Marie Charot, which states that teenage mothers frequently report that they have no support or they feel like they are alone. If the teen mother already had depression before their pregnancy, there are some common factors in adolescent depression that may contribute to making impaired health decisions in regards to the pregnancy and the child. These common factors were shown from a research study done by Beth Barnett and Margaret DeVoe, and they are negative self-concept, loss of interest, passive coping style, cognitive distortions, and a feeling of lack of control over events. Schaefer and Kipp are authors that report that teen mothers are more likely to have prenatal and birth complications, and that since teen mothers know less about child development, they view their babies as more difficult and stressful. This reaction to the child could affect the child mentally and emotionally long term. Many teen mothers are not mentally ready for a child. Taking a look at some of the health effects, author Philip Baker informs that several studies have found that teenage pregnancy is associated with adverse medical outcomes for both the mother and the baby. These include maternal depression, anemia, low birth weight, preterm delivery, and increased prenatal and infant mortality. All of these are very serious medical issues. For children, there is some more risk to their health while inside the womb. As I mentioned earlier from the author Philip Baker, children of young mothers are at a great risk since they are more likely to be born prematurely and underweight. This can cause multiple health problems for the child long term. But some of the health problems of the child can be avoided entirely if the young mother makes the right choices. Authors Schaefer and Kipp report that teenage mothers are more likely than older mothers to use alcohol and drugs while pregnant. So, how does this alcohol use affect the unborn child? According to the article written by the American Academy of Child and Adolescent Psychiatry, alcohol causes facial deformities, slow and retarded development, as well as brain and neurological problems. These are only a tiny portion of the ways alcohol and drugs harm a fetus, and all are life-term effects to the child's health. These are just a few of the ways of how having a child so young could affect the mother and the child physically and mentally. Although the circumstances of the teen does play a huge role in how severe the health and mental risk can be. If the teen lives in an encouraging and supporting environment and has adequate prenatal health care, the chances for the mother and the child increase tremendously. For more information, visit teenparentconnection.org. This is an organization that is dedicated to helping out teen parents. They have many different programs to help the teens, and one of these programs is designed to enhance the child's health and development. Thank you for listening.